The Cook County Department of Public Health has announced 32 municipalities they will focus on for their vaccine equity distribution programs.
Yeah, and the areas are located mostly in the west and the south suburbs of Cook County. And now these are mostly communities of color that have been impacted most by COVID-19. Want to bring in right now Dr. Rachel Rubin. She is the co-lead of the Cook County Department of Public Health. Thank you for coming on the show this morning. We appreciate it.
Thanks for having me.
So talk to us about how you came about determining that these were the areas that you needed to focus on.
Well, we've been noticing since the beginning of the vaccination push out, and this has happened nationally, is that the people that have been signing up and have the most quickest and most agile access to getting the appointments have been predominantly the more well-off and white communities and individuals throughout suburban Cook County. So we have always had at the forefront of our approach an equity approach and trying to make sure that we have the most impacted communities have access to vaccine as readily, if not more so, than those communities that are less impacted. And those impacted communities predominantly more impacted are, besides our elderly, are our Black and brown communities. These are communities that have been hardest hit by the pandemic in terms of higher numbers of cases and deaths. So now that we are beginning to get a bit more of a supply of vaccine, we specifically have the ability now to do more targeted vaccinations in terms of going into communities or providing certain communities with access to appointments, direct access to appointments at our vaccination sites throughout suburban Cook. So there is an index called the Community COVID Vulnerability Index, CCVI, or COVID Community Vulnerability Index. And that's an index, it's sort of a numeric score in a way, but it looks at socioeconomic factors of a community, racial factors, education, housing, a variety of these kinds of factors, as well as looking at how many cases there have been in a particular community.
Dr. We want to take a look at some numbers as well. I didn't mean to cut you off, but we want to look at some numbers as well. I'm sure it played a role in your decision making about which areas to focus on. But take a look at this graphic here. McCook only 0.4% fully vaccinated, Dixport 2.3%, Riverdale 3.1%. Talk about what's going on here in these communities.
Well, these are on our list, obviously, of the 32 communities that we have targeted. And these are communities that have not found easy access, or nobody's had easy access, but appropriate access to vaccine. These are communities where public transportation is not readily available to other parts of the county. These are communities where people don't necessarily have the economic or other resources in order to get vaccines. So we know that we need to get vaccine to them in their own communities, or provide them sort of specific appointments where it doesn't mean that you have to be in a split second be on the computer and be able to sign up. Because people also in these communities don't necessarily have access to the internet or computers in order to sign up on the online systems.
Well, Dr. Rachel Rubin, co-lead of the Cook County Department of Public Health, I want to thank you this morning for coming on the show. We appreciate it.
Thank you very much.
All right. Today's